Hello everyone, welcome to Move Well, Live Well. We've been having a number of people complaining of sciatica, and what's happening is they're having pain in the hip, starting to go down the back of the leg, into the butt, down the hamstring, sometimes down the lateral part of the foot. And what we're seeing a lot, why they're having this problem, is one of the rotator cuff muscles, some of the rotator cuff muscles within the hip are having problems with range of motion. They're lacking some range of motion in the hip. Typically, internal range of motion is what they're lacking. Now, normal internal range of motion of the hip is, you're looking at 30 to 40 degrees. So this is external rotation of the hip, so as the knee goes outward. Internal rotation of the hip is as the knee goes inward. And normal internal rotation of the hip is 30 to 40 degrees-ish. And what's happening is some people, they have plenty of external rotation of the hip, but then they get to do internal rotation, and what's happening is they're just coming about maybe 5 to 10 degrees, and they're not getting that internal rotation that they need. So what's happening is that the muscle is starting to lock up. The rotator cuff muscles of the hip are starting to lock up, causing spasm, getting pain symptoms going down the leg. So here's a quick, easy stretch to help eliminate or increase that internal rotation of the hip, thereby decreasing that sciatica pain and getting you feeling better. So you're lying down on your back here, and your legs, on the side view, you're looking like this. So you're just lying down on your back with your knees up, and you're here. That's what it looks like from the side. From the front view, you're here. And what you're doing is having your legs, you start with your legs here, bring your legs apart, keeping the knees inward, and now as far as you can go, and now you're gently going to push inward. So you're getting internal rotation of the hip, and you're getting both hips at the same time. You can lie down, relax, breathe in, breathe out. You can even do a contract, relax, where you're pushing with your heel or the instep of your foot into the floor. So you push your instep or foot into the floor, 2, 3, 4, 5 seconds, relax, and then pushing in again. And you can repeat that 3 or 4 times. Do this for about 3 to 5 minutes every day, and that'll help increase the internal rotation of your hip and get you feeling better in that hip, thereby decreasing that sciatica pain that you're feeling. You can also do internal rotation using one leg at a time, adding a little bit of overpressure with the opposite leg like this, and then switching. There you go. Internal rotation of the hip. As you get better and better, that pain from the sciatic nerve will decrease, or that referred pain from the trigger points in the rotator cuff, typically that's what's going on, will start to decrease. Thanks for watching. If you have any questions, leave them in the comments. Like, share, subscribe, and we'll see you next time. Thank you. Bye-bye.